What if the very thing meant to enhance your health or appearance is actually making you sick? Millions of people struggle with mysterious symptoms, brain fog, fatigue, joint pain, when they don't even realize that their immune system may be reacting to a foreign body inside them. From breast implants to joint replacements, surgical mesh to IUDs, your body may see these as invaders, triggering chronic inflammation and even autoimmunity. In this episode, I'm uncovering the hidden connection between foreign materials and your immune health, plus what you can do to take back control.
Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Hello and welcome to the Feel Better, Feel Great podcast, episode 155, Unmasking Autoimmune Triggers. Are implants making you sick? In each episode, we dive into the wonders of holistic health and functional medicine to empower you with the knowledge you need to lead a healthier, happier life. I'm your host, Dr. Andrea McSwain. If you're new to me, please like, subscribe, and click the bell for this channel. Please remember that the information provided in this podcast is for educational purposes only. Always seek the advice of your physician with any questions you may have regarding a medical condition or your health objectives. Today, we're talking about something that often flies under the radar: foreign bodies in your body, like implants, stents, and even IUDs, and how they can trigger immune dysfunction and unexplained symptoms. If you've been struggling with vague, mysterious symptoms like fatigue, joint pain, brain fog, gut symptoms that never get better, and you start to also see that there's some autoimmune conditions with no clear cause, this episode is for you. We'll break down why this happens, and more importantly, what you can do about it using the functional medicine approach. Let's dive in. So how do foreign bodies trigger the immune response? I think that's really important to start considering is really, what is this overarching immune system? And then how does it get disrupted by foreign bodies? This is such an important question. And one of the things you'll want to hold on to, because there's more elaboration in this episode, is elective versus essential foreign bodies and what you can do in each of those areas. So people come to me and they, talk to me about feeling all these symptoms. They don't understand what's going on. And sometimes we really get down to the fact that there is a foreign body that their immune system has recognized as an enemy and is starting to develop antibodies and attack. And that is a very strong obligation of the immune system against these foreign bodies. It's chronic, and it makes the immune system be obligated to attacking the foreign body, which means it has less ability to sometimes attack infections, environmental exposures, other things related to stress, things that we eat, etc. The immune system is designed to detect anything that doesn't belong in the body. When there's a foreign object, whether it's metal, silicone, plastic, is introduced into the body, the immune system sees it as a potential threat. The immune system is constantly providing surveillance throughout the body. And so it is actually looking for if it's actually looking for the presence of an enemy. So immune surveillance is a very important concept because your body is always surveilling what's going on, right? Your immune system is always surveilling what's going on in the body. When there's a foreign object, this leads to chronic low-grade inflammation, sometimes causing the body to develop autoantibodies. And these are proteins that mistakenly attack your own tissues. In some people, an overactive immune system because the body has developed autobodies. In some people, this overload of the immune response and the development of autoantibodies can contribute to symptoms of autoimmune conditions that affect the thyroid, affect the joints, and can lead to things like thyroid disorders, rheumatoid arthritis, and lupus. The longer the body perceives a threat, the more dysregulated the immune system can become. And this can lead to fatigue, inflammation, and multi-system symptoms. That is a very important concept to think about because dysregulation of the immune system leads to exhaustion, chaos, disorganization, and so the body just really doesn't know what to prioritize, right? And then the body just starts getting out of control. So this is why people develop conditions such as breast implant illness or complications from metal joint replacements. Or we've even seen patients with breast cancer who have a significant reaction to the bead placement for location. And there's sometimes people just do fine when they have implants. So it all depends on the immune system's threshold. So what is your immune system's threshold for these things? And what is it that is essential as a medical implant? And then what is it that is elective, right? And a lot of times when people are introduced to an implant, they're often told this won't be a problem. You know, that it's fine. It's just sitting there. But in actuality, it just makes sense to think about, well, what is my immune system doing, right? Your immune system is always looking to see if there's an enemy, right? It's always recognizing that actually there is an enemy. There's always potential for bacterial overgrowth. There's always cells that have to be destroyed because they are abnormal. There's always some kind of environmental exposure that's coming into the body, whether it's mold or seasonal allergies or pollen, right? These things make the immune system continually work. Even eating and drinking water or drinking a beverage, the immune system has surveillance over that. The immune system is activated whenever we put anything into our mouth. So again, looking at all these ideas as persistent foreign bodies or regular exposure to foreign bodies and the essential role the immune system plays in processing the information about foreign bodies. There are essential medical devices, right? So these have a higher benefit and they're necessary for health. So these obviously can include pacemakers and stents, right? If someone is deciding to have a pacemaker and working with their physician on this, it's really probably going to happen and it needs to happen, right? To pacemake their heart. If there's stents that need to be placed, etc. These are really necessary for heart function, for survival. However, we have to recognize that this is a foreign body. And while it is more essential to have this in for survival, there's some things we need to discuss about what could happen with those and what we can continually do about it to support the body in the healing process. The other thing are joint replacements. So hip, knee, these are essential for mobility for some people, but they can also trigger metal sensitivity. And there's been a lot of work that's been done in these essential medical devices to remove the allergy stimulation or the immune system stimulation. However, it is not perfect. It is still a foreign body, and the immune system is still going to mark it as a foreign body, and it's still going to monitor it. It's still going to increase inflammation, and it's still going to cause immune system distraction or obligation. Another one is surgical mesh, which in some cases is an essential medical device, and potentially in some cases it could be more elective or there could be some other options. Surgical mesh is often used for hernia or pelvic floor repair. These are used for structural support, but can lead to chronic pain in some cases. Absolutely. Yes, and surgical mesh is not all the same. There's definitely some considerations with that, and that's in another episode. Okay, so let's talk about elective foreign bodies. These are much higher risk and no life-threatening necessity. Okay, so these can be copper IUDs. So they not only can cause systemic inflammation, they actually do cause inflammation as part of the way that they work. They inflame the endometrial lining of the uterus so that it cannot house an egg, right? And so when we look at its function, the copper IUD is actually designed to create local inflammation. However, that can then be exacerbated and create systemic inflammation. And it can also worsen autoimmunity in sensitive individuals. Okay, there are cosmetic fillers, silicone, Botox, synthetic hyaluronic acid, PMMA, and many others. But these synthetic cosmetic fillers can cause chronic inflammation and even granulomas, where the body rejects it and creates a wall around it that becomes permanent as a blob wherever the filler was placed. Also, as these things are broken down, they're then distributed through the lymphatic system and other peripheral tissues to where they were injected. These are foreign bodies, and the immune system is monitoring them when they are injected and also as they continue to deteriorate and be distributed throughout the rest of the body. So that's important to think about with cosmetic fillers. There are other fillers that are not synthetic, and there's even different hyaluronic acids that are not synthetic. Anyway, just so you know, cosmetic fillers versus aesthetic and wellness fillers are a little different. And then, of course, breast implants. And breast implants can definitely trigger immune dysfunction, and there is something called breast implant illness. If you have breast implants and you have fatigue, joint pain, achiness, somnolence, you can't get any organ to really make sense, everything is just kind of seems wrong in your body, I would encourage you to be in many of these breast implant Facebook groups. They help you understand the journey of a lot of people who have breast implants and what they're doing about it. That is very important. When you feel like there is something going on, what is it maybe a little more specifically? So what are the common symptoms of foreign body-triggered immune overload and autoimmunity? If your immune system is reacting to a foreign body, how do you know? And many people struggle for years before connecting the dots. I was just talking to someone the other day, and it was very clear to me, based on the symptoms that they were explaining about their wife, that they likely had breast implants and maybe they also had Lyme. So I suggested these as ideas, and it was confirmed that the person did have breast implants and that in their teenage years they missed quite a bit of school because of Lyme. And so those are exacerbations where the immune system is already obligated with infection, and then the person introduces a foreign body, and now the immune system is in overload. And now the immune system is starting to create antibodies to attack the foreign body. So the antibodies are like special soldiers. They're markers that keep the immune system activated to keep attacking the same thing. And that is why these symptoms become persistent. Common symptoms like, again, fatigue and brain fog, joint pain and muscle aches. That's often misdiagnosed as arthritis or fibromyalgia. Of course, there's skin issues because the skin is an organ of elimination, and it's very much a part of our defense and repair. There's rashes, hives, eczema. Then there's hormone imbalances, because when the body is struggling with its immune system, it will often not be very interested in having hormonal balance. So there's a lot of menstrual issues, thyroid issues, and a lot of disruption of the endocrine functions in our body. And of course, chronic persistent infections. This might be seemingly a low-grade sinus infection or a chronic yeast infections or recurrent UTIs. And this is because of a suppressed or confused immune system. So many people don't realize their chronic symptoms may be linked to implants or foreign bodies, and standard blood tests often miss the connection. Okay, so welcome to the idea of thinking about functional medicine solutions and how to mitigate symptoms. Now that we've identified the problem, let's talk about what you can do to support your body, whether you have an implant or are considering removal. First of all, proper identification and testing for inflammation. You want to request tests like CRP, ESR, ANA, and metal toxic element panels. I also like the Avise autoimmune marker panel, especially if you have insurance coverage of labs, because that one's very well covered if you have insurance. You want to look at gut health, and you want to look at your secretory IgA in your gut. Okay, this is oftentimes where we see that gut inflammation is the starting point. Okay, because most of our immune system, as people say, is in the gut. Step 2 is to support detox pathways. Okay, so the liver is a very important organ to keep moving out pathogens or detoxification of foreign bodies, right? So obviously we encourage the 7-day detox in our practice, and I think that works really well. There's elements to it that a lot of people use in general. A lot of liver support in general, like glutathione, milk thistle, cruciferous vegetables, cabbage, broccoli, cauliflower. These do help clear toxins on an everyday basis, but to really facilitate the support of the detoxification pathways, especially when there's a presence of foreign bodies that are causing symptoms, is to think about the 7-day detox. You can really reset in 7 days. It's very impressive, and that's why we do it. Okay, second, lymphatic drainage. So dry brushing, sauna, infrared sauna, check the electromagnetic frequency, of course. You don't want to be heating yourself in a microwave-like environment. And then manual lymphatic massage. KPS Essentials Slim Massage procedure is my personal favorite. It's what we've been offering in the clinic for over 7 years. It's impressive in how you can add nutrition to have lymphatic drainage. A lot of lymphatic massage is moving the lymph, but what we like to offer is actually nourishing the tissue so you can facilitate the movement of those toxins. It's impressive. Other ways to support detox pathways, infrared sauna, as I mentioned, ozone therapy. Check out my other podcast for information on that. And then, of course, anti-inflammatory diets and nutrients. So we want to remove inflammatory foods. If you read the 7-day detox from JJ Virgin, or How to Lose 7 Pounds in 7 Days, the main key there is by removing inflammatory foods, the body reduces the fluid overload, and then that is the weight loss. These inflammatory foods can be gluten, dairy, processed food, sugars, and some other ones like corn, peanuts, and those corn and peanuts are big ones as well that people don't think about, but they are highly inflammatory. Other things you can do to support anti-inflammation, add your omega-3s, turmeric, antioxidants. Of course, thinking about starting with the gut, probiotics and gut healing are very helpful. The next step is consider explantation or removal, if that's possible or necessary. If symptoms persist despite interventions, removal may be the next step. And I have had a patient who decided to keep her breast implants, but she recognized the ongoing support of her body that was really necessary in order to maintain having a foreign body that was causing her symptoms. When I look at functional medicine, I think often about like, okay, let's put some things in place to help kind of create that Band-Aid effect, right? And that's what you're doing if you do recognize that there is a foreign body that needs to stay, or you're electing to stay in the body, then there's work to be done. And that's okay. You definitely want to do what I said, reduce inflammation, add the nutrients, make sure your detoxification pathways are supported. And these are lifelong commitments. Maintain testing on a regular basis, at least annually. And if they remain elevated, you want to test these inflammatory markers every 6 months so that you know what is happening in your body, because you might be making different decisions if you see that the inflammatory tests are going down, right? Or conversely, if they're going up, that you have the opportunity potentially to make different decisions. And that's very important. You're in control of your body. It's your body. There are times when implants are medically necessary and they also cannot be removed. But there are also times where you might be making different decisions with information that you have. I did work with another patient who was experiencing these symptoms for maybe 10 years. They were getting progressively worse and basically consuming her life. When she recognized they were related to breast implants, she felt like the breast implants were not worth it. She had the breast implants removed. She was able to receive the breast implants as specimens from the surgery, and noted that there was mold within the breast implant. So that's another consideration, is what implants do as an opportunity for potentiating some infection. Now, it did take this person about 2 years to recover from the implant being present in her body. So she kept noticing progressive improvement in cognition and in having joint integrity and being stronger and having more energy. But it did take some time, and that's important to remember too. So the goal is not to alarm, but to empower, right? Many people live with implants and thrive with the right support, while others feel best after removal. Either way, functional medicine and staying on top of it, understanding what's going on, can help rebalance your body. So if you want to take some next steps, I would say first, start tracking your symptoms. Do you have unexplained fatigue, joint pain, brain fog? Is it all the time? Okay, this is another trick that I really like, and it's called counting your successes, finding the pearls. So not just writing down the bad days, right? I don't really encourage my patients to write down the bad days. I encourage them to write the good days, because what made it good, right? Were they eating better that day? Did they get really good sleep? Did they handle something at work really well? What are those antecedents or triggers before feeling really good? And if you can recognize what helps you feel really good, then we can build on that. So I encourage you, especially if you've been feeling really bad, there are probably a few days in the month where you do feel okay or good, and you can build from those successes. That's how I view tracking your symptoms. Second, get the right lab tests. We want to look for inflammation. You want to look for heavy metals. You want to look for autoantibody markers. And of course, foundational to all of this is making sure that your metabolism is functioning correctly, so you know your nutrition levels. You know some of the other functioning levels related to how you process carbohydrates and fats and proteins. And you have that metabolic testing always foundational. And then also looking at gut testing, very important as well. And then supporting daily detox pathways so that you know that you can keep moving out toxins, right? Fundamental to my practice is nourish, kill, remove. And so you want to keep removing those toxins out, because their presence of a foreign body is requiring more demands on the detoxification pathways. And that again is lymphatics, gut health, anti-inflammatory nutrition. Seeking guidance is always helpful. If you suspect your implants or medical devices are causing issues, please talk to a functional medicine provider. Or another option, of course, is to look at our functional wellness membership, the Feel Better, Feel Great membership with me, where we dive into these topics on immune health and detox strategies so that you gain the knowledge and education for a lifetime. Your body always has the power to heal. It needs the right support. Thank you so much. Please, again, subscribe, click, share. We would love to have more people understand what I'm offering and how I can be of service to you. Thank you. Have a beautiful day.